There are 3 common prostate problems that almost all men will experience at some point in their life. They are benign prostatic hyperplasia, which is the enlargement of the prostate. They are prostatitis, the infection of the prostate. And then the big one, it's prostate cancer. And all 3 of these are preventable to some degree, so it's important to know. Hi everyone, my name is Dr. Hunter, and let's dive in. Now the first one we have is benign prostatic hyperplasia, or BPH commonly referred to. Now this is just the enlargement of the prostate. It is not cancerous and it is very common. 50% of all men over 50 will experience this, and the symptoms you can look out for obviously is a weak stream. You have to go to the bathroom very often, especially at night. There's a lot of after dripping after you go, and it feels like you have not quite finished or empty your bladder after you go. Now what we can do is we can use supplementations like saw palmetto, which has been proven to reduce the swelling of the gland. Also zinc, about 15 to 30 milligrams a day. And then we have to just look at what we take in terms of alcohol. We don't want to overdrink or take in too much alcohol. We do want to stay hydrated during the day, but we do not want to take too much water, alcohol or coffee before we go to bed. Couple of hours, because you are going to wake up quite a lot and go to the bathroom a lot. And then very importantly, don't sit the whole day. Exercise is important to get the blood flowing and keep the blood flowing down there. So that's BPH. And then we have the nice and painful one, prostatitis, infection of that prostate. Man, it's going to be painful to urinate, and there's a deep inside, almost inside pain. It almost feels like it's in your rectum. You're going to have fever and even chills. Very painful experience. I once had this over a long trip because I kept it in. I didn't go to the bathroom. Very, very bad idea. You do not want to keep it in. Full bladders do make this worse. Once again, you want to stay hydrated. Quercetin is a natural inflammatory that you can take, 500 milligrams a day. You can add vitamin C with this, 500 milligrams to 1000 milligrams a day. Once again, exercise helps. I know it's very painful, and I would recommend that if you have these symptoms, you go and see your physician or your doctor, because many of them would require antibiotics to be taken. Number 3 is the big D, prostate cancer, and it is sadly very, very common. 1 in 8 men experience prostate cancer. It's also very preventable and treatable with early detection, so one of the more treatable cancers. What we can do in terms of prevention, omega-3, 1000 milligrams a day can help with the functioning and the prevention, and vitamin D also plays a very important role. About 1000 to 2000 IU per day can help, but the main thing you want to do and check out for with prostate cancer prevention is that if you are over the age of 40, just go regularly for your PSA checks. It's a blood check to test and see what's going on. Basically, without going into too much detail, you can also go for an ultrasound, but when you're over 40, go for regular checks. It's very preventable, and after all, we have to look at our big men down there. With that, thank you for watching. I hope you learned something. Consider subscribing to the channel for more. Thank you and have a wonderful day.